Hello, this video is about lip and brow wax, and we're going to combine it. So we're going to start first actually with what you would do upon arrival. And you're coming into work, so you'll get into work, you know you have a wax appointment coming up, and you're going to wash your hands. So you turn the water on and wet those hands. You're going to wash your hands with liquid hand soap. You're going to find that. You're going to take your hands underneath the water with the liquid hand soap, and you're going to rub your palms together, and you're going to rub your back of your hands together with your soap down to your wrists. You're going to rub in between your fingertips. You're going to wash your fingers. You're going to wash the backs of your fingers, of course, fingertips and nails, thumbs, in between your fingers and your thumbs. Wrist, and you're going to make sure that you do that for at least 20 to 30 seconds minimum, and then you will rinse everything off thoroughly. When they've had a proper rinse, you're going to get either like a disposable paper towel or a clean towel, and you're going to turn off your water. Then you can dry your hands, and then you're going to toss your paper towel. When your hands are nice and dry, you're going to get some hand sanitizer, and you want to make sure you read the back and that it's 70% ethyl alcohol, and then you're going to do the same thing with your hand sanitizer. And then it's about preparing your space for your client in the proper way and the sanitary way. So let's talk about how you're going to do your room setup. You will, I'm going to go over my tray in a minute, but you will disinfect your workstation, your bed, and your equipment using a disinfectant wipe, following the manufacturer's instructions. You will check the equipment to ensure that all devices are in safe working order and plugged into a working receptacle. You'll gather clean supplies needed for the facial service, storing in a clean, closed container, and then you're going to dispense the products needed for the service. So the way you do that is you prepare disposable portion cups for each product with a portion of the product by opening the top of the container and ensuring the tip of the nozzle does not come into contact with the disposable portion cup or tray. Or remove the product with a disinfected or clean single-use spatula, close the lid to the product, set the portion cup or tray on the tray, and then you throw away that single-use spatula. Place disposable table paper on the disinfected bed to ensure that the wax does not fall onto the bed. So I have placed a towel down here because that's what I have. Then you can greet the client, and your client arrives, and of course you note that when you meet with your client, your hands are clean. So then you take your client and escort them to your workstation, and then you have to do your analysis. So you're going to assess their style and determine their preferences. You can assess the client's needs and then assess the client's skin by performing a visual skin analysis to ensure that there is no inflamed, infected, broken, raised, or swollen skin in the area that's going to be worked on, or an open wound or sore in the area to be worked on, infection or infestation such as lice that would prevent from safely performing the service. You'll assess the client's consultation form for any medications and products they've used within the last 72 hours and consult on any known allergies. You're going to consult with the client on any facial surgeries within the last 3 months and if the client is under a physician's care. Assess if the client is prone to cold sores or fever blisters, and then assess if the client has been using exfoliating or lightening agents within the last 72 hours, like alpha hydroxy acids, beta hydroxy acids, hydroquinone, etc. Assess facial injections within the last 3 weeks, like Botox or hyaluronic fillers, and if the client is free of all of those contraindications, that we can move forward with the procedure, which she is. So remember that your hands are clean. You're going to wash them again, but we're going to get her comfortable. So what we want to do is get the client prepared. So we're going to lay her down on that table paper on the bed, and you're going to get her comfortable. So we're going to make sure that she is. I'm going to take a rolled towel and place it beneath her neck for support. I'm going to take an additional towel and drape it over her drape, or like a cape, because I don't have a cape right here, so that no wax could get on her clothing anywhere or her body. And then I'm going to take, you can take your hairnet, you can take a headband. You want to get all the hair out of the way because you don't want to get any wax on her hair also. And then it's at this point, this service is performed with gloves on. that you're going to go ahead and wash your hands and put your gloves on. So you're going to turn your water on and you're going to find the liquid hand soap and you're going to repeat just what we did in the beginning. So you wash your hands down to the wrist. You wash the back of the hands down to the wrists. You wash the fingers and the back of the fingers, of course. You wash between the fingers and the thumbs. You wash fingertips and nails. You wash thumbs. You wash wrists, and you do that for a minimum of 20 to 30 seconds. Rinse it all underneath the water. When everything's properly rinsed, get a clean towel or a disposable paper towel. Turn off the water. Dry thoroughly. When you're done, grab your hand sanitizer, and then you're going to go through that process and do this quickly. Now, one thing with your hand sanitizer, because you're getting ready to put gloves on, is you need to make sure that your hands are dry before you attempt to put on your disposable gloves, or they will not go on. So I'm really realizing that. That's why I keep saying it in every video, because I'm like, if your hands are wet, also you could, the gloves could split. So I'm going to put on my gloves. And the first thing we're going to do is assess anyway. We're going to look at the areas of the face that we're going to wax. We're going to start up at the top with assessing her eyebrows. And what we're looking at is the hair, how much she has or wants to remove, which you've talked about, the way that the hair is growing that you're going to remove. So give yourself a minute here to do that. And then we're going to go ahead and prepare the area for the wax. Now, you're going to check the temperature of the wax in a minute, but let's go ahead and just get her brow area ready. So the first thing we want to use is an antiseptic remover here to make sure there's nothing on the brow area, like makeup, oil, like from eye cream or moisturizer or sunscreen, all that stuff. So we're going to remove that first. Take your time, do what you need to do. I'm going to get it all off. And then once you've done that part, go ahead and we want to make sure the area is super dry before we apply any wax at all. So we're going to take a little powder and apply it all over that area too, so that it protects the skin before you start your waxing, and it helps with that, maintain that dryness that you want. And you're also always applying with the direction of the hair growth. So I'm going the way the hair grows for her brows. This is how her brow hair grows, because I just assessed. Okay, and then you would be able to start your waxing at this point, except that we will never go to a client with just wax. We have to check the temperature on ourselves first. So what I'm going to do is I'm going to take a little bit of wax, and actually before I even, let me back up real quick. Before I even get to work, I want you to be able to see my tray. So just a quick glance over and down. Hopefully it works nicely. There we go. And let me review what I have on my tray. So I have my cleansing portion here, like the antiseptic. I have my powder. I have my wax, which of course would have been in a wax pot, but we're showing you this for the video. I have my remover, and I have my final soothe step. I've got my tweezers, cotton rounds, mini scissors if I need to cut some more strips. I've got a ton of strips here. I've got all different sizes of the sticks for the wax. I've got some paper towels and Q-tips, just emergency disposable things here. So you know that it's all available to me here. So let me get her back, and then I'm going to test the wax on myself. I'm not going to test it on her. I'm not going to just go wax her brow without testing it on myself. So the first thing I'm going to do is grab a little stick here and put some wax, and I'm going to test the temperature on the inside of my forearm. So that's what I'm doing right there. And it feels good. I'm going to remove that wax. And I feel safe and comfortable and confident to go in to perform the service for her, that I will not, it wouldn't be too hot for her skin because it felt good on me. So I'm going to use some wax, and we're going to start on the right eyebrow. Going in at that 45-degree angle, and then I'm going to apply the wax in the pattern of hair growth, like the way the hair is growing. And I'm going to get another guy because I need some more wax over here. Where this one grows, the hair grows a little bit more towards the down, out and down. And then I'm going to find my wax strips, and I'm going to apply pressure along the wax strip where the hair grows. And what I'm going to do is I'm going to remove the wax going against the growth, but I'm going to pull the skin nice and tight first, remove, and I'll apply a little pressure with my finger. And the same thing here, the pattern is different, the hair grows in a different direction. So what I want to do now is hold it tight, remove, pressure, and that just helps with that stinging. Okay. Now we're going to go to the top of the brow. And I have broken my little sticks in half. I would never do that in salon just because of the videos. I am being very conscientious of all the things that we're purchasing. Just trying to make it go a little farther. For videos, not for real life. We are not working estheticians yet, right? We are learning. Okay, so we've got that one on, and we're going to get our strip. Once again, going in a couple different directions. So we're going to start with this one, and before I pull, I'm going to make sure the skin is nice and tight. Remove and apply pressure. Awesome. So that went pretty well on this side. What we need to do now is we're going to get some remove to get rid of any wax residue before I head in there with my tweezers and see if there's anything that I need to get with that, like some little baby hairs or something that the wax just wasn't on or wasn't able to get, so that her brow is polished. Also with the tweezers, you can control the shape. So it may be where you go in and you do your detail work, if you guys have discussed a certain look that she's going for. So let me grab a cotton round and my tweezers, and I'm going to go in and remove the hair in the growth, in the way that it grows. Sorry, I'm having a hard time talking here. I'm going to pull it out that way so it comes right out instead of breaking off at the layer of the skin. It's actually going to come out completely. And I think if the wax got it all out and the tweezing got it all out, then when it regrows in a similar pattern or a timeline versus some of it just being broken off and some of it being removed. And that brow looks really nice. Just getting those little babies here. Okay, so now it's time to move to the other eyebrow. I'm going to soothe at the end altogether. So what we're going to do is we have prepped it and powdered it. It's ready for the wax. So we're going to move right in. Trying to be very conscientious of the time that this service takes because it's waxing. It can sometimes be painful. So we want to be solid with the work, but as quick as we possibly can. I know people love the results, but they don't always like to get waxed because it's not the most comfortable, which I totally understand. I've had this service done more than you can imagine, as well as the lip, and it can be painful. And we find our strips. And we go in. And we are going to find that taut skin before you remove and press. With the hair growth, and then we pull it off away, making sure we get the skin nice and tight first, and press. Nice. And now we're going to do the top of the brow. With the growth. Hold it tight, press. Tight, press. And we need some remove. Any wax that might be left over, and then we're going to find our tweezers and take a minute here to clean this brow. Once again, those little baby hairs or really perfecting your lines, detail work that a wax strip may not be able to do for you, or you see that you need to control the shape a little bit more. You're taking a hair at a time with tweezing, so it's a little bit easier to do that. And you're definitely going in the direction of the growth of the hair when you pull it out. Okay, now we've got to do this little middle area to finish the brow up. So taking time here because this hair grows down. So what we're going to do is apply the wax with the growth of the hair going down in between the brows, and then we're going to remove it by pulling up, and that will help remove the hair, hopefully most of it. And nice pressure down to get that wax to stick to the strip, and then find that tight position for the skin. Rip press. You are good. Nice. And we'll get a little remove going once again if there's any wax residue, and we'll double check if we need to tweeze it all. there are any little hairs, we want to get them. Okay, and we're applying that product also in a downward motion. Okay, we've got our, yeah, there's a little bit, couple little hairs right here, nothing major, because we've already tweezed all the other surrounding areas. Good, yay, good, okay. So what we're going to do now is the soothe step. So we are going to apply all to the entire brow area now because we've done all of it. Calm everything down. It was great. It's also going to be applied within the growth pattern of the hair. So in the way the hair grows, we're going to put this beautiful calming, soothing post-epilation. And she's happy. So that part is done, but now we have to figure out our lip because the same client is getting her lip done. So we're going to go down and assess. We're going to do exactly what we just did. We're going to assess the growth of the hair. Just put this away. And then we can move forward with the application. So we've got some out to the side, we've got some down, we've got some down. So we know that's where we're going to go. So we're going to work on the right side of the lip first. And this is a smaller area. It's not like two brows. So I'm going to do the whole lip before I finish. So we are going to do wax application time. For the lip. And I didn't have to check the temperature of the wax again because it's the same client and I've been working on her the whole time. If this was a new client, I'm going to check the wax temperature every single client, every single time. No question. All right, we're going to pull and press, press, press. And then we are going to tighten the skin there so you can remove and press. And hold the skin nice and tight, remove and press. Okay. We're going to keep working, once again, because it's this smaller area. You don't want to just tweeze one side and then wax another side and tweeze one side. You want to get it all done. So let's get this wax applied to this side. I have had this service done more times than I can count in my lifetime. Oops. And you don't want to wax, after you've waxed an area with the soft wax, you don't want to go back on top of it. So everything we do once we do the wax, we're going to tweeze. So making sure we get a really good first round go, then we don't have to worry about it. Because you're not going to go back on top of it again. Okay, so we are going to tighten the skin before we remove the wax strip. And then press. And then same thing for this, different direction of hair growth. So we're working a little bit differently. Nice tighten to the skin before you pull it away and pressure. Good. And then the last area that we need to get is the center of the lip, and that hair grows down. So we're going to get that on right now. And it's that small little area there in between that goes like a little groove that goes down. You want to try to get it all there and up to that right under the nose. Okay, and then you're going to get your wax strip and you're going to press down. And then before you remove it, once again, you find a way to hold the skin nice and tight and press. Okay. And she did a great job. So let's remove any excess wax from the entire lip area. So now we've finished with the wax, and then we can go back with our tweezers. But we want to make sure there's no residue. And then we can be picky and specific. If there's anything left, we're going to get it with our tweezers. So I've got my tweezers, I've got my cotton round, and I'm going to go to this side first. And I'm going to remove, not a lot, there's a couple here right close to the lip. Then I'm going to remove. And a little bit right under the nose, which is always hard. You don't want to get your wax in the nose, like down to the very edge of the lip and then right up to the, can be a little daunting. Good. And go to the other side. Same kind of concept here. A little bit along the lip. And then right up to the nose. Really looks good. And I'm removing the hair in the direction of the hair growth. And I'm ready to throw away my cotton round, put the tweezers down, and we're going to get some soothe here. So we need to calm that down. Some post-epilation, that really went well, and she's fine. It's just we want to make it even more fine. Help the skin relax. Okay. Beautiful. Okay. So what we would do now is show our client how amazing she looks. And she's so happy. She's going to book her next appointment with us because she's hairless on the places that she wants to be, and her brows are shaped beautifully. So very happy there. Then we're going to discuss any kind of maintenance and aftercare with that client once you're done. So you can remove these gloves right here, and you're going to tell her you know, what she has to do, what to expect at home, how often she should come in to rebook, etc., and you'll get her checked out. Once you do that, you've got to do your area, your station. You got to clean it. So your gloves went into the trash. You did your client follow-up. Any single item use product that you have not thrown out yet, you need to do that immediately, which is actually what I'm doing right now, because as we scrolled around, there was stuff on some of my paper towels. So I'm going to do that right now. Single-use item in the trash. And then you're going to place the implements that you used in a closed container labeled to be disinfected. You're going to take all of the linen here, like towels, cape, headband, whatever you have, and you're going to place it in a closed container until it's time to do the laundry. You've got to identify, work and clean your work area and disinfect. So you have to identify proper cleaning agent, read the manufacturer's directions, and follow the manufacturer's directions for mixing and usage. You have to wipe down your workstation and area with cleaning solution to remove debris. Identify disinfectant that is bactericidal, virucidal, and fungicidal, EPA approved for use in salon setting. Follow manufacturer's directions for mixing and or using appropriate aerosol disinfectant. Disinfect electrical equipment and store in a clean area separate from other implements. Then you'll remove those gloves because it's time to do your final hand wash. And the reason you had gloves on is because you had to do the bactericidal, virucidal, fungicidal sanitation part. disinfection part. So you will wet your hands first. You're going to get a coin size of liquid hand soap, rubbing the palms and the back of the hands together down to the wrist. You're going to wash the fingers, backs of the fingers, between the fingers and the thumbs. You're going to wash your tips of your fingers and your nails, of course, your thumbs. You're going to wash your wrists, all of that, 20 to 30 second minimum. Rinse it all off. Either use a clean towel or a disposable paper towel to turn the water off. Dry everything thoroughly. Once you're dry, throw your paper towels away and find your hand sanitizer, which is 70% ethyl alcohol, and you'll finish with the hand sanitizer. That will finish your hand wash section. And that is exactly how you do your eyebrow wax and lip wax. This was a combo client video.